Hi, my name is Christa Penner, and I'm a human kinetics major who did my fieldwork placement at the Alpha Center here in Regina. The project that I worked on during my time at the Alpha Center involved looking at how performing strength exercises that were exclusively isometric, concentric, or eccentric in nature improved the pain experienced by various patients. My direct supervisor is an exercise therapist, and together we perform assessments and create exercise prescriptions. This center takes on a lot of patients who are involved in SGI or WCB claims, so we would see a lot of similar injuries. However, the mechanism of injury is always different between patients, so there is a lot of variety each day. Since we see a lot of similar injuries, we noticed it was difficult to determine which exercises specifically were the most useful in decreasing pain. We decided to create a small research project that would look at comparing the effect of 3 different types of strength exercises, isometric, eccentric, and concentric, and how that affected pain reduction. Our plan was to get a patient with a particular injury to perform a different exercise set during 3 separate visits, with the goal of determining the best way to manage their pain. We wanted to see which type of exercise would allow them to leave with less pain compared to when they came in. In our study, we had 2 people with wrist injuries, 2 people with ankle injuries, someone with a knee injury, and someone with a shoulder injury. We would ask the patient to rate their pain according to the functional pain scale 4 times, when they first came into the clinic, during the strength exercises, following the exercises, and in a follow-up call the next day. We discovered from the results of the study that it was consistently isometric exercises that were the most beneficial in decreasing pain. This was the idea that we had gone into the project with, believing that it would be isometric. Once we realized isometric was clearly the best for pain management, we moved to focusing on which was better between eccentric and concentric. We discovered eccentric was the second best for pain management. However, giving a patient an eccentric exercise program is not as easy or efficient as prescribing concentric exercises. Because our study was not very official, there were a lot of variables that could have accounted for the change in pain apart from the particular exercise prescription we gave for that day. We tried to adjust for this by asking for their subjective measurement of pain more frequently, so it was no longer just before and after, but also prior to coming into the clinic and follow-up the next day. The results of the study will help the agency when a patient comes in and states that they have a lot of pain and their main goal is pain management. The exercise therapist can then pull the sheet containing our data and explain that isometric exercise will be the most effective in managing their pain. I was also able to gain professional skills while working with the patients to discuss where their pain was at. If I had the opportunity to do a study like this again, I would choose more patients and have them come in more frequently to get more data. Even though we had a smaller sample size, we were still able to gain a lot of valuable information that both myself and my fieldwork supervisor will be able to use in the future.